Hey everybody, welcome back to our podcast, The Pathway. My name is Taylor Henrik. I'm here with my co-host Sarang Patel.
Hey guys.
And today we're going to be talking about seasonal affective disorder and some of the complexities that come along with this disorder that we deal with throughout the year.
Let's get it.
Here we are again in the Great Lakes state, and we are facing a difficult time of year, right? So you get through the fall. Call it the fall, you get through a couple holidays in a row, okay? You've got Halloween, you've got Thanksgiving for those who classically do have the traditional holiday sense, and then you've got a couple different holidays over the winter time, followed by New Year, right? So then you transition into this time where there's no holidays, except for, I guess, if you want to call Valentine's a holiday, that's fine, a Hallmark holiday. But you've got this difficult time of things that you have to get through when you're trending towards spring. Granted, there are holidays during that time, but nothing that would symbolically lead to like, oh, I'm off, I'm spending time with whomever, or I just have time to myself. So I like to call January and February dog days of winter, right? Classically, we have the dog days of summer, hot, it's warm, you're just sweating every day. But in the winter time, I call it to my clients, I'm like, hey, let's grind through this time. If you're stable in January and February, you can be stable any time of year. That's what I always say. Again, that's not always true. A lot of people enjoy the winter. A lot of people enjoy the seasons. But we can recognize that it's a difficult time from a not being able to get outside and exercise standpoint, from a you may be more apt to spend time at home standpoint. And again, it's just, you're going to be a little bit more shut in. It's harder to do things. Cars break down, houses are cold, etc. The list goes on. This all turns us to come to the point of seasonal affective disorder. Can you tell us a little bit about seasonal affective?
Yes, I mean, simplifying it, right? And we're not getting all super technical here for those out there that are going to read DSM-5 and come at us. But, the biggest thing is just to make it really simple is, lack of sunlight exposure, right, can affect and seasonal changes. I shouldn't even say lack of sunlight, but seasonal changes. Because I would say that some people have it the opposite, like you mentioned. Winter months are good for some people.
Absolutely.
Like Shaboy is striving in the winter months because above 70, I'm too hot. So lack or change of seasons affect, typically is more the winter, but they affect moods, whether it's depression or it's anxiety, or I would even argue it in general, from the mood standpoint of irritability, racing thoughts, those kind of things. It can affect people's sleep pattern. It can affect their interpersonal relationships, work relationships, all those kind of things, right? And like you mentioned, you go to work when it's dark. When you come home, it's dark, right, at 5 o'clock. So it's like you kind of don't get that freedom almost, it feels like, right? You feel like you're kind of stuck in a rut, kind of feeling like a routine, and you're eagerly waiting for summer to come or for the weather to at least change a little bit for whichever one you're going towards that you enjoy. So it's cool to be in Michigan and get all 4 seasons, and we say, oh, it's awesome, you get all 4 seasons, but if you don't like all 4 seasons or they do affect your mood, it can be hard.
Absolutely.
And not everyone has the ability to move, right? Some people are like, oh, we'll just move. Like, okay, seriously? Like, that's just an option for everybody.
Right.
Like, I can't just move to Florida if I want to move to California, wherever you want to go to. It's not practical.
Right. Let me just pick up my entire life and move at the drop of a dime because the weather sucks.
Yeah.
Not that easy, right? Not practical for a lot of people. And for my clients that I can empathize with in terms of winter's tough, right? Maybe they don't enjoy the outdoors activities. Plenty of people, snowshoeing, skiing, snowmobiling. There's a lot to do. Don't get me wrong. But for those people that just don't have an affinity for those types of tasks or loathe the cold winter months for one reason or another, I always tell them, I say, all right, let's get through January and February. Let's give ourselves something to look forward to. You and I always talk about a carrot, right? The proverbial in front of the horse, put a carrot in front of them and they'll run. For us, it's, hey, I need to incentivize something, right? Whether it's planning a trip, getting in some warm weather, or like we're doing now, getting involved in like a sporting activity, giving yourself something to look forward to on a week-by-week basis as things slow down post-holiday. So it's like this post-holiday hangover, but you still got 2 to 3 months of rough weather, right?
And no football.
And football's slowing down. We're going to be done in a couple of weeks here. And so it just gets hard. So I always tell people, all right, bear with me through January and February. Let's have some dedicated, intentional appointments, in terms of clients on this phase, because we're talking about a disorder specifically. And then let's get to March. March to me is the turning point, right? March is still going to be fairly cold, plenty of cold days, but you're going to get glimpses of spring, right? So I always tell them, let's get to that point. And then when you're past March, we're looking at 6 months of good weather, right? For those that the weather really affects. I mean, it's something that I have conversations with my clients about almost every day that I see patients or clients. It relates to the weather a lot. Like, it's one of the first things they say. Like, how are you? I haven't seen you in a month or two. How are you? Well, the weather's been bad. I'm like, whoa, that's the first factor you want to throw at me in terms of like how things have been, right? So it just shows that like it's something that comes to mind right away. Or like, my sleep has been really poor. Okay, like let's dive into that. But the seasonal changes play a significant factor in their presentation, I feel. Do you feel the same?
And I think that it's one of those things where, like, you say we wait till we get to March. It's hard to sometimes tell people that, just like kind of chill and kind of get there and let's see what you get there. So then they say, well, what can I do right now, right? So you might tweak an antidepressant. You might actually add antidepressant, right? You might actually try to adjust whatever they're taking medication-wise to kind of help out with it. But then you also implement certain things, right? And I tell people all the time, it sounds super cliche that all your doctors or prescribers may say this, or mental health or healthcare providers would say this. Drink more water. Mm-hmm. Try to get into a good routine, especially sleep routine is super important, right? Now, you can't sleep the same time every single day, wake up the same time every single day. It's not doable for some people, but you try to keep a schedule to try to keep your rhythm, your circadian rhythm kind of aligned as much as you can. So if you keep these routine things in, if you need to exercise, even if it's walking in the house and you can't get outside, right? Because I have a lot of elderly patients, I'm like, go outside and slip on the pathway,
mm-hmm.
the pathway.
Mm-hmm.
But instead, I'm like, walk inside the house. Like,
right.
If you have to, make a lap in the kitchen, make a lap on your first floor, whatever you can do a little bit more,
stairs, yeah.
more than you've been doing normally,
mm-hmm.
like you would do in the summer, to kind of be intentional about it. 15, 20 minutes. I'm not saying go all day, just do a little bit more if you can do that, right? If you're able to physically do that. Put these things into place. You can use one of those, sad lights, we call them, right?
Mm-hmm.
10,000 lux, LUX, right? I always say get them on Amazon, try to purchase them. You don't have to sit underneath this light for 50 hours of the day or 20 hours of the day, but try to be intentional with it. Whether you're eating breakfast, if that's what you do, or if you come home from work and you sit on the sofa and you watch TV, have that light shining in direction. As much as you're able to do it, try to utilize it.
I really hope people are listening to you on this topic. Take-home topic, right? Buzzword, buzz point for the entire talk. This stuff makes a difference.
Mm-hmm.
I'm going to repeat it. This stuff makes a difference. It sounds so cliche to say make sure you drink half your body weight in ounces of water a day. Do it and tell me it doesn't make a difference in terms of your energy, okay? Practice good sleep hygiene. Try to get the appropriate amount of sleep for your age range. Focus on introducing some healthy foods into your diet on a daily basis. Avoid high sugars and high levels of caffeine. Get mild to moderate exercise 3 times a week. And tell me how you feel, all right? It's easy to say, well, I drank enough water. Okay, but how much did you drink? I had a bottle of water a day. Okay, that's probably not enough. That's 16 ounces of water. It's not enough to get you through the day. If you start to put some of these practices into place, maybe interject some multivitamins, right? Maybe do some other things that make you feel happy. Make sure you read or do something that brings joy to you every day. You will see a difference. And I agree with you wholeheartedly. I know I'm reiterating what you already said, but the mood light, the SAD light or the mood light that you can get on Amazon for a very fair price, not trying to promote this product, but I've seen the difference it makes for a lot of my clients. Put it on to the side while you're watching TV. Put it on to the side while you're reading. There are just various different ways that you can introduce yourself to some of that UV, whatever the light is that it's promoting for you, to keep vitamin D levels supported, right?
Right. Take your vitamin supplements, but I also tell people that it's not going to work fast, and it's not supposed to work fast, right? Like, you got to use a sucker for weeks, for months. You have to use it continuously, right? It's like, when you're growing up, your mom always tells you, right? Like, it doesn't happen overnight. You have to keep doing these kind of things, keep making it happen, right? Eat healthy in general, not just like a one-day thing, hope you feel better, right?
Absolutely.
So you try to implement these things, and sometimes it works. So external factors, the lights, the vitamin D, the water, the schedule, the sleep schedule, interpersonal relationships. We talked about it earlier, doing some stuff for yourself during these times, being more intentional about it at this time than maybe during months of weather where it's a little bit easier for yourself to feel better. Really focus on that. I always recommend clients, like, if this is a big issue, increasing your therapy appointments. It doesn't mean you have stuff to vent about necessarily, but they will then help you keep track of your treatment plan of these goals. Right? We always talk about goals. But there are other goals that are like, hey, like how are you doing on your water intake? Someone help following you, someone keeping you accountable is super important too. Sometimes that can be your therapist. With myself, I might increase the frequencies of appointments too because we may make a med change. That could be awesome. And some people go on a medication just for the winter months and come off it. I would say that's more rare in my clinical experience, just personal opinion, right? Maybe I've been wrong out there, right? But I think that some people then will go on a medication, maybe stick with it because they feel better with it too. And every year you kind of reassess it. That's why I always tell people, I don't give you a medication or prescribe a medication and say, I'll see you next year. A lot of stuff can change. A lot of stuff can change within 90 days. Like follow up. It could be super quick. We may not make an adjustment, but that's okay. Like I always say, like the quicker the appointment, typically the better you're doing. Like that's good. You know, if it's not broke, let's not fix it either. Let's just kind of chill with it. That's fine. But at least you touch base. You know, if you need to get in, you already have the appointment set up. I kind of feel comfortable knowing like I can sleep better at night knowing that, hey, like, you know, you're chilling, you're doing okay. And I think that when, you know, and we talked about this before, right? Like I have a lot of, I don't know how it works out, just the way that life works, but I have, unfortunately, a lot of elderly patients who are unfortunately widows. And I think it's really hard for them. They don't have someone to kind of lean on at the time. They might be living by themselves. So sometimes having those check-ins once a month, super brief, are a world of a difference for them, right? And this is not what I'm saying, but this is what they're saying too. So I think that's a really important part for those who may be listening, who are maybe clinicians, maybe out there, like increase the frequency might be helpful for them as well.
Absolutely. And I appreciate that's a good segue. I was going to ask you, clinical philosophy, I hope this is interesting, but I want to dive into this very briefly. When you're accounting for SAD, so seasonal affective in the setting of chronic depression, do you believe in dose adjusting just for a seasonal change? Not implementing a new med. I know you commented on that already, but do you consider dose adjusting a medication just to account for the winter months? What's your thoughts?
So I think that if someone is saying that, hey, you know, generally every winter, you know, things are rough. I'm more down. I've got a little energy, got a little motivation. And it's harder with the weather, obviously, like the sunlight and stuff changing, right? But I have more anhedonia. I don't enjoy the activities I used to like doing, if it's like crocheting, reading, sewing, whatever you want to do, right? If they've historically had that be an issue, then going into that winter months, and I will keep that data into every visit moving forward. So next winter, I'm not asking you, well, what happened last winter? I know, like, because in case you don't mention it, I know, like, the winter months are kind of challenging, like we talked about before. We're going into winter months here. What do you think we should do? And then if they have external stressors, right? Unfortunately, a job loss, a pet loss, a parent loss, a life stressor, then for sure, if they have that external factor and they have a history of SAD, then I will probably prophylactically, if that's the right word to use here, increase an antidepressant, another medication, whatever they're taking that's working for their SAD, or add something. I will do that with the intention of telling them that I have zero clue what we're going to do with this medication. That's word for word what I use. I have zero clue what I'm going to do when the weather changes. If I knew that, I would go straight to the casino because I could tell what's going to happen. So every situation is completely different. And I'm not really sure what's going to happen here. But we're going to follow up. We're going to make sure less meds is the better, is like what we always kind of say, right? So if you don't need the medication, we'll maybe come off it. We'll see how you feel. But if I go into it telling you, hey, next March, the weather should shift. We're going to take you off the medication. And then March rolls around and I'm like, no, I don't think we should. You're going to be like, dude, what's going on here? Right? So you have to let it like marinate a little bit. Give them both options and it's the truth and we'll see what happens. Because when March rolls around, you could have had an external stressor happen in February, January, March, April. And now we're already going into it like, let's take away the medication because weather's changing. No, you have to look at the other stuff as well. That's why a lot of these things in mental health are not cookie cutter. That's why it's not a protocol. It's not a cardiac protocol you kind of follow and you know what you're going to do, right? Every situation is completely different because there are continuous, the way life throws you curveballs, continuous external factors that you've taken to place that may be minor to me, but major to you, and vice versa.
That's a great point. The point you make there is absolutely valid. And from a foundational standpoint, you can go all the way back to like medication adherence, right? Is the client consistent with their medications? Yep. But I think what I'm hearing from you is it depends on the situation. One, I mean, that's always going to be the case. But when you're coming to that divergence and it depends on, you basically said if there's a provoking factor, you'll make the jump, right? If you need to. But it goes back to our philosophical treatment method. We both believe in seeing our clients more often. I can say wholeheartedly, it's not from a financial standpoint. It's not because we're trying to make life difficult on our clients. It's because we want to see our clients more often. We want to spend time with them, get to know them, and go over their actual concerns. The idea here is not see you and boot you out 6 months and then we can check in twice a year. Absolutely not. So I love the fact that you said sometimes I'll see my clients more often. That shows that you want to spend more time with them. You want to make sure that they're in a safe space. Right. You're protecting their well-being because we know it can be a difficult time. It absolutely can be. All it takes is, like you said, a lot of times the holidays are associated with loss or change in circumstance, housing situations, job-related issues in the new year, right? Things can happen where companies have to reassess and people get let go for a number of reasons. So I like the fact that you're focusing on, again, it's ambiguous, but I will take it either route. We'll do either one. We'll do what meets the client's needs at that time. We can't sure shot say, yep, I'm going to take X medication up to this dose every winter.
No,
it's not that simple. We can't account for that.
No. If you know that the holidays are a trigger for you, anxiety, depression, even PTSD for a lot of people, right? Whatever it may be, because of a loss of a loved one before, like I said, based on my patient population, kind of what I'm seeing, then I will, if I'm seeing you post-Thanksgiving, let's say, I will intentionally make sure that I see you before the next set of holidays. And again, like you said, there's many holidays for many different people, so it depends on, you got to know what holiday they're talking about here, right? Different religions, whatever it may be, fine. So if you know the holiday's coming up, or they say, hey, this holiday's kind of hard and it's coming up, keep in your notes for the future, right? In case like Diwali or whatever it is, that's not your traditional holiday you may not celebrate. Then you know that, okay, I'm going to follow up with you before the holidays come just to check in to see how you're feeling. If it is a massive trigger, which I have a lot of patients, there's a massive trigger, right? Christmas can be a big trigger for a lot of people. Then I may see you before and after. Because if I don't see you right after, then I'm giving you another whole month of post-trigger and saying, oh, wait to see me again end of January, and then we'll see what's going to happen.
Correct.
And a lot of stuff can happen in that time frame. So now that may not be practical sometimes to see those people, back to back like that fast. But I always tell people that work, at Pure, you have to fit them in. Like, do what you got to do to get them in.
You make it work.
You make it work. If you can't get them in, get your colleague to get them in. Make sure the next colleague that helps you out can make it make sense. Because ultimately, it's our job and our responsibility to make sure we get them in before or after if they need it. Not that I'm full.
Right.
You know what I mean?
Yeah. The intensity of your will to maintain your client's stability is something I've always admired, because you're always the type to say, I'm going to do everything I can to make sure that my clients are stable. That's my number one priority. And I appreciate that. Let me lead you down a little bit of a different pathway here. We've focused almost solely right now because seasonally we're in winter, right? But let's talk about SAD that establishes itself in other seasons. Let's just go into it, right? Let's talk about the person that really hates fall. Okay, or summer or spring. It doesn't matter where we talk, but how would we help those individuals? How do you approach somebody says, the fall is a precursor to winter and I do very poorly this time of year. So talk to me about September, October. Obviously we're not there right now, but it's still an apt conversation to have. How do you approach that, knowing what's coming ahead?
So there's two different variables, right? There's those that are going into summer, right? Because maybe I have some people that don't like summer. It's warmer. They can't sleep well at night because of the heat. Like, it's a big thing, right? I don't like it hot when I sleep. There's a lot of things that kind of change for summer for some people. But then, like, if you're saying going into September, October, that way you're prepping for the winter months. So, when the summer starts to end, whenever end is happening, right? School's kind of starting. Is how I put the time frame for me. I'm asking, like, hey, how are you going to feel the weather changing? I'm already asked these questions. It doesn't mean I'm making a med change. It doesn't mean doing anything.
Correct.
And they may be like, nah, it's not a big deal. All right, cool, just noted. Let's move on, right? But you start to ask those questions at that point. That's a quick 30-second question, right? A couple follow-ups. How we're doing at that time and if it's going to be an issue. But again, you should know historically for your patients if it's historically an issue or not. SAD, if it is, then you're going to ask that time.
That's our job as the provider.
Yeah. But if you're a new patient at the time, you're still going to ask because you're not sure. So in fact, at that time, you have to start when the summer's ending. Like, how do you typically do it during the winter months? Are they typically harder for you? Is it better for you? How do you feel? What's challenging? And you should know by the triggers if it's a loss of a loved one or a job or anniversary dates of deaths, unfortunately, whatever it is, that come generally during those times, right? For a lot of people. You have to kind of know that. So I just kind of prep it the same exact way. Whether you're deep in the heart of winter, the down days you call it, right? In January, February?
Dog days, yeah.
Dog days. Or you are going into the winter months, you're still prepping the same way, in my opinion. Right? So you don't want to catch it. If the winter months are super severe for people, or moderate even, or mild, why wait till January, February when you could have started to make changes in September?
Good. So your approach is proactive and consistency.
Right.
If you keep the same approach and you're constantly keeping adequate notes, you're going to know what your client's triggers are throughout the year, right? Passing difficult anniversaries, passing times that associate with other things, distressing memories from the past. So it's nice to have that diagnostic piece and then correlate it clinically. I like your answer.
So how about going into the summer months? So I don't know why, but I'm thinking about it this way. That is, I think a lot of parents, a lot of kids struggle going into the summer months because it's a seasonal change, typically like the summer months, but it's a change in structure, right? So your kid goes from having a routine to now all of a sudden not having a routine. Do you see that as being just as a big of an effect on our kids going into summer months with school being over, whatever you want to say, besides camps and stuff, just like it can affect a lot of SAD for adults?
Yeah, it's a great question. It's a great contrast because the loss of routine can lead to more behavioral changes. In some cases with our adolescent and pediatric population, I see a burgeoning of anxiety during that time because they know they don't have school.
Right.
They may either spend more time with their family at home or not, right? It may just mean that they're spending more time on their own. I definitely see behavioral changes when it hits June. June to August is a unique time because of the summer. It's classically a great time. You're out of school. Things feel great. But for a large population, say those that are afflicted by ADHD or other behavioral disturbances that hit our pediatric and adolescent population, there absolutely is a seasonal change. So when you look at seasonal affective disorder, I think our minds automatically ping to winter. But your call here by saying that seasonal affective, it's an affective change to your mood, affect, whatever, hits any season and is commensurate with any behavioral or mood-related change, absolutely. You see a seasonal change during that time. It's a really good point to make and something that has to be accounted for as a clinician, a therapist, or a providing individual in the care of anybody that you're seeing.
Yeah, you have to also prep the parents going into the summer months. It's not normal, but it can happen, and I guess you can call it normal, that the sleep patterns will change. They're sleeping in a little bit more. They don't have to wake up in the morning. So try to keep their schedule as consistent as you can. I'm not saying don't let any kids sleep in. I mean, I get that, right? But you want to try to keep some sort of consistency if that is a typical issue that does lead to behaviors, right?
Yes.
Some kids can sleep whenever the heck they want to sleep and it doesn't cause any trouble. It's fine. But some people we've seen, there's a correlation between sleep pattern and quality of sleep, adults and kids, and their functionality throughout the day, whether that be work function, school function, or behavioral issues. And we've seen that, man, if we just get sleep stabilized a little bit, dude, these things improve tremendously.
Monumental difference.
Yeah, not maybe 100%, but it makes a difference. It's important to do. We need to kind of focus on that. And summer months, I think, always kind of messes people around. The same way I tell people as an adult, I'm just going from segue to segue here, but the same way I tell adults who unfortunately lose their job or something happens and they have a life change, you have to keep a good sleep schedule. Or if you go on disability, whatever it may be, you have to keep a good sleep schedule because it's the same correlation between being a kid going into summer months, and your sleep schedule all jacked up, and you're an adult. Now you may not have to wake up in the morning for work or whatever it is because maybe you don't have it, you're looking for a new job, whatever it is. So you want to keep that consistency because we are creatures of habit.
Absolutely.
And routine.
Absolutely. Ending on a light note today. How about something that always makes me laugh? Facetiously, when I'm talking with parents, I do appointments often with the parent and the adolescent or the pediatric patient. And just another factor that can relate to seasonal change is, do you ever have parents of clients that are like, yeah, I'm pretty ready for them to go back to school, that 100%. End of summer, it's end of August, we're aiming towards Labor Day. And the parent's like, summer was great, very busy. My kid was in 8 different sports. They did 4 different camps, and I'm run ragged. I'm ready for them to go back to school.
Yeah.
It always kind of gives me a little bit of a chuckle, just kind of talking with the parent or talking with the kid. And they're like, yeah, I'm kind of ready to get back to it, ready to see my friends again. It's sometimes nice to hear that,
Yeah. I think it's funny, but it's the truth to a certain extent. A lot of stuff going on, and we just passed it, right? With the holidays that just passed.
Yeah.
The same thing happens during Christmas break. They're like, oh, the first week is cool, and then it's like, all right, when's school starting back up here, right? Unless you're traveling or on vacation, you kind of want to get back into that routine, that sense of the kid not being home sometimes kind of nice, right? A little bit of coverage, and then you kind of enjoy that time. So, it's funny, but it's the truth to a lot of people, right?
Absolutely. Well, I hope you enjoyed this walk down the pathway with us today. We appreciate your time, and we'll see you back soon.